Welcome to our presentation on CORE's collaborative care platform, rapid access, on-demand care, and informed behavioral health consumers. Before we get started, let's look at the behavioral health trends that are making headlines in the industry. With these headlines, we see a theme emerging. There's an increase in demand for services in the post-reform era, yet there's a scarcity of qualified professionals available to serve this increase in population. While at the same time, we also want to change consumer behavior through higher levels of engagement and consumerism. In order to solve for these challenges, we've created a borderless, on-demand, and collaborative behavioral health environment, the CORE Collaborative Care Platform. In this single solution, we're serving both consumers and qualified behavioral and mental health professionals by providing rapid consumer access to provider services via our service locator, seamless consumer to provider video chat for personalized crisis intervention, a truly disconnected mobile behavioral health EHR for boundaryless care, targeted consumer education material to encourage health literacy, a secure personal health record to enable consumer self-management, and an integrated outcomes analysis to monitor the consumer recovery process. This solution was brought together in collaboration with our partners, HealthWise for the health education content, and also the Mental Health Center of Denver for their outcome analysis tools. Now that you understand the focus of our innovation, let's see the CORE Collaborative Care Platform in action. For our demonstration purposes, imagine you were a consumer suffering from a behavioral health issue such as depression. By simply logging in to the CORE Collaborative Care Platform service locator, which is depicted here on the screen, the consumer is able to quickly find a list of available qualified mental health professionals within close proximity to where they live. With the CORE Collaborative Care Platform, this consumer doesn't have to wait hours or days to get access to that provider. To solve for this consumer's on-demand needs, they simply click on the video chat function and they are seamlessly engaged with a qualified mental health professional.
Hi, my name's David. I'm with the Whitman Walker Clinic. How can I help with you today?
Hey David, my name's Matt. I was looking for some help. I've been really depressed lately.
Okay, would you say you're in a crisis situation or anything like that, Matt?
Not in crisis now, just depressed.
Okay. I don't think there's going to be any problem. Let's ask a couple questions and we'll go through some things.
We just demonstrated that in one click, the consumer was able to seamlessly engage with the new qualified mental health professional. Now we're going to switch our perspective to demonstrate how the professional uses CORE's mobile EHR to check the client's profile.
So Matt, maybe you could give me some information so I can get things started here. Have you ever been, in contact us with them in the past?
I have, yeah.
Okay, maybe you could give me your full name and your date of birth and your address, and I can look things up here.
My name is Matt Adams. The date of birth is on January 1st, 1990, and my address is 555 Main Street in Washington, D.C.
Okay, hold on one second. Let me bring a record here. Oh, I see that you did contact us a couple months ago. Let me just confirm that everything is right here. You said 555 Main Street, correct? And your phone number is 202-555-5555, correct?
Yes, that's correct.
Okay.
Now that we've verified the client's profile, we're going to continue our demonstration by initiating a depression screening.
Thanks, Matt. In order to get the right care and services for you, do you mind if we ask you a couple of questions?
That's fine.
How would you describe, whether you've had little interest or pleasure in doing things? I'd like you to tell me whether it's been, not at all, none within the last several days, more than half the days you don't have relatively any interest, or nearly every day you feel like you don't have any interest.
I'd probably say several days.
You're feeling down and depressed or hopeless. Is this several days that you're feeling this? More than half the days? Or nearly every day are you feeling like this?
Nearly every day.
As you can see, the mobile EHR module within the CORE Collaborative Care Platform provides one-click access to a wide range of clinical tools such as screens, assessments, recovery plan forms, to provide timely and borderless care to this consumer. Our platform's outcome analytics from the Mental Health Center of Denver are integrated with our clinical workflows and forms in order to increase the efficiency of reporting as the client continues through the continuum of care. After the on-demand service is completed, the provider and consumer can continue to engage by sharing the visit information via secure online personal health record, which is depicted here on the screen. This creates a central location to help the consumer manage their recovery process and helps them to be better prepared for the subsequent visits with their provider. We can see that information that was gathered from the consumer's last provider visit is already populated in the record. Within the PHR, there's an option for the consumer to access health education content. This can be done by clicking on the Educational Resource tab below. The consumer has the option to identify themselves or other people within their family that might need health education. In our demonstration, we'll pick the man. The consumer then can select the area where the problem is. In this case, we'll select the head. This action presents a short list of available symptoms based on the consumer's input. This then instructs the consumer to take a short survey. As you can see, there are several questions here that relate to the consumer's issue, and it's coming up with a result of try treatment at home, where we can further get health information to help the client deal with his issue through self-management. This concludes our brief demonstration of CORE's collaborative care platform, providing rapid access, on-demand care, and helping to inform the behavioral health consumer. We thank you for your time and for watching our video.